My name is Dr. Scott Kutz, and I'm a neurosurgeon at Texas Back Institute. The evaluation of someone's gait has always been important to the spinal surgeon, but it's always been as a general, subjective overlay on the patient's overall condition. We know the gait is important. We know it's very important to the patients and their quality of life. It's important for their safety. Patients with spinal pathology are often at risk for falls, which can create other injuries. And so now having the ability to formally and objectively evaluate the gait, I think it provides a lot more useful information that I, even before I came here, would not have had the knowledge or the idea that I would have been able to assess those movements and the gait performance so precisely. I use the gait analysis in my practice to assess primarily at this point outcomes. So I can look at patients with various different spinal conditions like cervical myelopathy or scoliosis or sacroiliac joint dysfunction, and I can assess how they do both preoperatively and postoperatively and what sorts of real changes my surgery is accomplishing for patients. As opposed to the ODI or the NDI, where the results are basically patient self-reports of how they're doing afterwards, gait analysis gives objective data. So we can measure things like their stride length, the cadence of their gait. We can measure EMG activity. We can see how much extra usage of muscles is being done and how inefficient gait is preoperatively, and we can compare that and see how much it improves postoperatively.
After the physician referring their patients to us, we can provide them an objective outcome on the patient function. So we can actually tell them how they're functioning before surgery and how they actually got better or worse objectively after surgery. Here, what we can actually do is give you an objective measurement of your function, how you're functioning. So we can tell you how your walking was improved and by how much. We can actually pin a number by how much. But we can actually quantify it and tell you by how much you're walking better.
Well, I think for patients, it's very useful to understand exactly how your spinal pathology is affecting you. It may be affecting you in more ways than you even realize. And similarly, by comparing that to postoperative results, we can see in what real ways we've been able to change your condition.